In this video, I want to talk about a vertical fracture. Here we had a patient that came into our clinic a few months back, and she'd been having pain on the upper right side for a while, and she couldn't figure out what was going on, and every other provider or dentist she's gone to really couldn't figure it out what was going on. So we ended up taking x-rays like we normally do when we have a new patient in our clinic. Here we have a bite wing of the right side. When you look, everything looks pretty good. You don't see any cavities. This was the tooth here that had been giving her problems. And then the second bite wing also looks good. You don't see any problem. Somebody would argue that there's something going on there, but this is not in the dentin, so you can remineralize that. But everything else looks pretty good here in the premolars and the molars and the interproximals here, where there's typically there's a lot of cavities. Everything looks good there. And then when I go to the left side, the same thing here. Everything looks pretty good. You don't see any cavities in the interproximals. And then when I took a PA of that area, this is not a cavity here, because the bite wings typically are much more accurate than this, but this is not a cavity. This must be some kind of shadow that was showing up here. When you look at this tooth here, everything looks normal. You can't tell. I mean, it just looks healthy. But when I did an exam where I had the patient bite down on the tooth sleuth, it's called a tooth sleuth, they would react to this tooth here. So let's say, I stopped chewing on this side of my mouth. I haven't been chewing on it, so I just avoid chewing on this side of my mouth, and I chew on the other side of my mouth. And typically that is the classical sign of a vertical fracture. Typically we would take x-rays like this, and nothing is going to be showing that there's a problem in the patient's mouth, because when you look at the radiograph, everything looks good. And then when you look at even in the picture, typically we take pictures here in our clinic for all the cases that we do, whatever it is. Then we take pictures on every patient. So we had here's the tooth here. It looks healthy. You can't see a cavity, you can't see a fracture, but typically these vertical fractures are small, they're tiny. You can't see them in the mouth, and there's different types. You may take an x-ray, you may do different exams, but nothing typically is showing up, but the patient knows that they're having pain. So I'll show you the rest of her mouth. Very healthy patient, just good smile. Nice young lady that was a lawyer, finished law school. Good bite here on the right side. The cusps, all of them are going in the right areas where they're supposed to be going. On the left side, similarly, very good situation here. So after doing my exam, I determined that the tooth really needed a crown. So she agreed to come to do the crown. So she came in, we did the crown prep. After we did the crown prep, we ended up scanning it into a 3M scanner. And here's one of the scans that we did. So here's the tooth here. We have a little bit of voids here. A little bit of void here on tooth number 3, but this is the crown prep after we prepped it. We scanned it into the digital scanner, and then we did the opposing, because you have to take the opposing. This is the lower arch. We did the opposing here, and then we have to articulate them together. We have to put them together so that the lab knows how they go together. Here it is again. So this is the tooth after we prepped it and scanned it in. So this is the upper arch, this is tooth number 4, and this is the lower arch, and tooth number 29 here. And then we got it back from the lab. We're cementing it actually tomorrow. So here's what the lab was able to fabricate after we sent them our scan. They took this and made this crown here. Here's what it looks like from the inside. Here's a side view of it. And so this patient is coming in to have this crown cemented tomorrow. And I'm gonna show you a picture of that crown that we just took. Here's the actual crown itself. I just took a picture of it. That's what it looks like. But typically we get questions from patients as to what a vertical fracture is. Now, vertical fractures are little microscopic. Sometimes they can be microscopic, they can be big, certainly where you can see it. And then sometimes if that's the case, then you have to take out the tooth if the fracture is too big. But a lot of times you can start with the crown, like we did here, and if the crown fixes it, then the tooth is good. And then if the crown doesn't fix it, then you may have to go through the crown here and do a root canal in the tooth, and normally that should fix it. Now there are cases where sometimes it doesn't fix it and you have to take out the tooth, and in that case you would end up having to do an implant in this site here, or do a bridge from here to here, but we're hoping that that's not going to be the case in this particular case. So anyways, what a vertical fracture is, sometimes they can be, they can be confined to just the crown of the tooth, like this one here. Sometimes they can go all the way down to the CEJ, right here to this cemental, the enamel cemental junction, the CEJ, right here. Or they can pass through that junction there and cause a lot of irritation to the patient. Or sometimes they can run all the way down from the apex of the tooth here all the way down to the apex of the crown there. In that case, typically you have to take that tooth out. Now if it's a fracture like this, just confined here to the middle part of the tooth, if you crown it, then you might be able to save it. Sometimes they can be just confined to the apical part of the tooth, of the root, right there. Sometimes they can be in the middle. Sometimes they could be, again, in the CEJ, between the CEJ here. So different cases are going to be different, and diagnosing these here is very difficult. You can take an x-ray like we did here in this particular case. You're not going to be able to see it. You can take a PA like this. You're not going to be able to see it because a lot of them typically are microscopic. They're very small. Now if it's big, then you'll be able to tell that it's in there. But if they're small, the patient is just going to tell you, when I bite down on something and I let go, then I feel pain. Then typically that's when we know that tooth is going to need a crown, sometimes a root canal, sometimes possibly even having to take it out. So anyways, we did a crown on this tooth. The patient has been having pain for a long time, and I think that we ended up fixing it. We're going to monitor the patient really closely going forward to see how it pans out. So if you're having pain in a tooth, or you can't chew on one side of your mouth because it hurts when you do that and you can't figure out what it is, or the dentist cannot figure it out, we're not saying we're perfect, but we try our best to do the best that we can for every single patient. Every dentist is different, and we're different as well, and we try to do the best for you, just like I'm sure a lot of providers out there try to do. But if you're having problems in your tooth and you need a dentist to try to fix it for you, give us a call here at Inwood Dental, and we would love to see you, your friends and family. Again, we do a lot of different treatments. We do crowns, we do fillings, we do dentures, we do implants, we do root canals, we do wisdom teeth, and we try to diagnose different things. And when you come into our clinic and we're diagnosing things, we wanna do everything we can. We'll take a radiograph like this, an X-ray, and then we'll take intraoral pictures so that you can see what it is that we're talking about. And then we're also very high tech. I like technology. I like what it does for our clinic. And typically we scan it into the computers, and we send it out to the lab, which is in Florida. These can get to the lab really within 30 minutes. We can get it to the lab. In the future, we hope to be able to make these in the same day, so that you don't have to wait 2 weeks when we get the crown back. But anyways, so we do a lot of different things. If you need anything in the dental field, please give us a call at 972-233-2341, 972-233-2341. This is Dr. Kachepa. We would love to see you, your friends and family, to get whatever dental treatment you need for you and your friends and family. So I hope to see you soon in our clinic here at in North Dallas at Inwood Dental. Okay, thanks. Bye.